Hi, everyone. My name is Carol Backstrom, and I am the Director of Intergovernmental and External Affairs at the Center for Medicaid and CHIP Services, as Erin had mentioned. And I want to thank everyone for joining us here today. I'm going to talk a little bit about the agenda, and today, our speakers, they're going to cover various strategies that your organization can use to engage community partners who may not be top of mind when you're thinking about your outreach and enrollment strategies. But these folks are key to helping us reduce the number of uninsured kids. First, we're going to hear from Child Care Aware, who will provide tips to connect with child care facilities to find Medicaid and CHIP eligible families. Next, our regional office within the U.S. Department of Housing and Urban Development will cover opportunities to integrate healthcare assistance into federal housing outreach. Then, Insure Central Texas will share their strategies to connect with potential enrollees through innovative outreach strategies. And finally, we're going to hear about providing healthcare options to small businesses from the Children's Partnership. Of course, we'll close with resources available through our Connecting Kids to Coverage campaign. And we'll, of course, also take your questions at the end of the webinar, so feel free to use your chat box throughout. But before we begin, let's answer a poll question. The question is, are you partnering with non-healthcare related organization in your outreach efforts? Please submit your vote by clicking on an answer that's on your screen. All right, looking for responses to the poll question. Are you partnering with non-healthcare related organizations in your outreach efforts? Looks like 77% of you are doing this now, but are anxious to probably hear some more ideas. And another quarter or so percent, 23%, looking to expand the partner network. So thank you for your responses. If you are engaging with non-traditional partners, we'd love to hear from you. So please share your ideas or strategies in the question section, and we'll share the strategies at the end of the presentation. So with that, I'm going to turn it over to Erin for our first speaker.
Great. Thank you, Carol. Our first speaker today is Melanie Brizzi. Melanie is the Director of Child Care Services for Child Care Aware. Melanie, we'll turn it over to you.
Thanks, Erin. Hi, I'm Melanie Brizzi with Child Care Aware of America, and I'm really excited to be here with you today to talk about how child care can be a great partner in your efforts to enroll families and children in medical coverage. Right now is a really exciting time to be in the early child care and education field. There's so much progress going on across all the states in creating healthier environments. And I think that this provides ample opportunity for some non-traditional partners. Child Care Aware of America is a nonprofit organization that's been working to ensure that families in every community have access to affordable, high-quality child care. And as part of this work, we lead projects that increase the quality of care. We conduct research on best practice and how to best impact child and families' outcomes. And we also advocate for policies that promote the health and safety of children and those positive outcomes that we're all looking for. Next slide. In addition to the research, advocacy, and quality improvement efforts led by Child Care Aware of America, there's another part of the organization that is funded by and partners with the U.S. Department of Health and Human Services, Administration for Children and Families, Office of Child Care. And that is the project that I am involved with, and that is called Child Care Aware. Our work in Child Care Aware in partnership with the Office of Child Care includes the provision of a website, the childcareaware.org website, where families and child care providers can find valuable resources and information about child care, selecting child care, for new providers, how to start the child care business, and for all providers, how to plan and offer high-quality services. We also operate a call center where families and providers and partners can call us and find the same type of information. We've also, one of the key priorities of both the website and the call center is linking families and providers to their local child care resource and referral agencies, which we refer to as CCR&Rs. And these are local agencies that can provide referrals to child care programs, and other services to families. Next slide, please. I mentioned that it is a really exciting time in child care, and one of those exciting changes is the law that was passed that reauthorized the Child Care Development Block Grant, or CCDBG. This is the block grant that's awarded to all states and is a significant funding source for states to provide subsidies to help families with the high cost of child care, as well as quality improvement initiatives. And so the passage of this Reauthorization Act, which is known as the Child Care Development Block Grant Reauthorization Act of 2014, requires states to make numerous improvements to the health and safety of child care environments, as well as to provide consumer education information to families. And this is one of the areas where I think opens up additional opportunity as states are working all across the country on implementing this new law that is going to require states to work with agencies such as a CCR&R or similar agency to provide low-income families who are receiving CCDF fee assistance information about the types of child care that's available, the quality of those child care providers, for example, a rating level if a state has a quality rating and improvement system. States are going to also be required either themselves or through partnerships to provide information to families on child development, recent research, and best practice, information about the state's policies that are in place to promote the social, emotional, behavioral, and mental health of young children, information about early intervention services through the Individuals with Disability Education Act, as well as information about other government-funded assistance programs, including Medicaid and state children's health insurance program. This requirement will provide families with a great deal of information that is critical to their ability to find care for their children that is healthy and safe, but also to provide additional information to help their family reach economic self-sufficiency and really thrive. And it's this opportunity to partner with the CCR&R or similar local agencies doing this work, and to opportunity to increase that enrollment in health coverage. I'll tell you just a little bit more about our child care resource and referral offices that we have across the country, because I do think that they are such a fantastic partner for your work if you're not already partnering with them. These are agencies. There are over 400 of them across the country. They provide a wide variety of services. The type of services that they provide often depends upon the system structure within that community, the needs that have been identified as highest needs. So there's a lot of different services, and each CCR&R may look a little different. Some of them provide referrals, either over the phone, online, or face-to-face for families who are looking for child care, so they have that one-on-one connection with families. Some may also determine eligibility for the CCDF subsidy program. They may be sponsors of a CACFP, that's the Child and Adult Food Program, that works to improve the quality of meals and snacks that are served in child care. Many offer provider trainings, mentoring, and coaching to help improve the quality of child care across a wide spectrum of areas. And they may be leading other quality initiatives within the local community, including those that are specifically designed to improve the health and safety of children. So these agencies are excellent programs to partner with, and not only partner with themselves, but generally very much a convener and connector of other early childhood initiatives and programs. They have that one-on-one contact with families and with the providers who are serving those families. If you are not yet partnering with a local CCR&R and you're interested in finding out who serves your area, Our website, the link is there on your screen, has a search feature where you can enter a zip code and find out who your local CCR&R is. Next slide, please. In addition to partnering with CCR&Rs, Reauthorization and all of the efforts at national, state, and local communities really provide additional opportunities to partner with the providers themselves. And this can be daunting. There's a lot of them, a lot of different kinds of child care, but there are ways to effectively and efficiently partner with child care providers. And our high-quality child care providers who are really seeking to serve families and children, and we have so many of them, work very intentionally around family engagement. And you, I believe, are probably familiar with partnering with Head Start, which is one type of early care and education program. But there are many others who are working to make sure that families have the information about all of the services that they need to thrive. Some states are embedding these requirements in other systems, whether that's a licensing system or their quality rating and improvement system. And I mentioned that briefly a minute ago, but a quality rating and improvement system is designed to give families an easy-to-recognize symbol for quality, something like a Better Housekeeping Seal of Approval, but also to provide the providers themselves with the assistance, training, support to improve their program quality and receive a higher rating. So 23 states have actually embedded standards within their QRIS, and not every state has one yet, but many do. And some are embedding standards that require higher rated providers to provide their families with information about other community resources, including information about Medicaid and children's health insurance programs. Some states are also embedding this same requirement within their publicly funded pre-K. So Indiana's On My Way Pre-K is one such program that the statute that creates the program requires providers to offer family engagement activities. And one of those potential activities is the provision of these sorts of community resources and available resources for families. Next slide, please. So there's lots of opportunity to partner through non-traditional child care partners, and that opportunity continues to grow. Some of those potential partners, if you've not considered these folks, of course, your Child Care Development Fund or CCDF lead agency and their staff. These are the folks responsible for implementing the new Reauthorization Act and for providing many child care services. That may look different in your state. We can also, at Child Care Aware, help you to connect to the agencies doing the work within your state. The intake agents are those folks that work directly with families to determine if they are eligible for the CCDF program. Again, they may be called something different depending on where you are working, but they have that face-to-face contact with families who are earning below 85% of the state median income typically, and can be a great partner. I've mentioned the child care CCR&R agencies, as well as other partners that are providing referral services to families could include folks like Help Me Grow, which is in several states, or 211, also great partners. Providers frequently have associations. For example, the Association for the Education of Young Children has chapters throughout states that could be a way to connect with multiple providers at the same time. Providers who are taking CCDF vouchers and are participating in the CACFP program are serving children from the target audience and are generally working to ensure the health and well-being of that child in a broad perspective. Faith-based providers are also great resources if you've not yet connected with your faith-based programs offering early care and education, as well as those pre-K programs that are serving low-income families. Also recommending that you partner, if you've not already done so, with agencies and organizations who are working on that multi-generational approach to poverty reduction. So this could include a home visiting program, such as healthy families. There's numerous different types of home visiting programs depending on where you live, United Ways, and workforce initiatives, such as those of Goodwill. Next slide, please. I want to tell you a little bit more briefly about one of the other initiatives at Child Care Aware of America that is working to improve the health and safety of child care and communities. And this is a project that's funded by the Robert Wood Johnson Foundation. In this partnership, Child Care Aware of America has awarded grants to the states listed on your screen: Alabama, Colorado, Indiana, Missouri, New York, and North Carolina. And they are working with coalitions, local coalitions, that are interested in working within early care and education programs. And they're working to advocate for healthy active living practices within child care, so good nutrition, exercise, and activity. And they're doing so through advocacy and working with states as they implement the state plan related to the Child Care Development Block Grant. So the assistance that's offered includes developing a toolkit that could be used by others on how do you work within child care to create these healthy environments for children. And I know that toolkit is in the works now and does include information about connecting families to resources for health care. And they'll be supporting these state teams as they work moving forward. They're also looking at issues such as nutrition, screen time, breastfeeding support, and safe sleep environments in child care settings. So these folks can provide additional opportunities for partnerships as well as for that convening and connecting with other local organizations who are working towards the same goals. Next slide, please. Looking forward to next steps or how Child Care Aware might support your work. Again, we can provide information, connect you to your state and local CCR&R agencies. We'll be able to connect you once the toolkits are developed to the toolkits coming out of the Healthy Child Care, Healthy Communities project, as well as the provision of information on our own website and through our call center. Next slide. You'll find on this slide my contact information. As you are working to engage non-traditional partners, please consider Child Care Aware in your local CCR&Rs. And if you have any questions or concerns, you can reach me at the information on your screen. Thank you.
Great. Thank you so much, Melanie. Really informative information, and I hope gives the folks on the phone some ideas to connect with child care centers in their area. Next, we will hear from John Hall. John is the Field Office Director at the Housing and Urban Development Office in Indianapolis, the Field Office. Thank you for joining us, John.
Thank you very much, and we are honored here to be involved in this webinar, engaging non-traditional partners to increase Medicaid and CHIP enrollment. As mentioned, I'm John Hall. I'm the Field Office Director here in Indianapolis. Our jurisdiction covers the entire state of Indiana, all 92 counties. I want to share a small snapshot about the U.S. Department of Housing and Urban Development, and then describe to you how we are working to improve health outcomes at the federal level, and that we are partnering with local stakeholders to increase the number of individuals who are signing up for our health insurance. Next slide. Last year, the U.S. Department of Housing and Urban Development celebrated our 50th anniversary as a cabinet-level office. Our Secretary, Julian Castro, adopted the name the Department of Opportunity in order to illustrate the underlying purpose behind HUD's wide-ranging program areas. He talks about zip codes, that no child should determine how far they can go by the zip code that they live in, and that includes health outcomes also. So Secretary Castro's vision for HUD focuses on 6 important areas. 1, we are building a stronger HUD that is more responsive to the needs of internal and external stakeholders. We are enhancing and strengthening our people, processes, and systems to build greater capacity. Number 2, we are helping families and individuals secure quality housing. Here in Indiana, 230,000 FHA insured houses has led us to a 68.9% homeownership rate. Number 3, we're fighting to end homelessness through our Continuum of Care grants and through our vast vouchers and collaboration with the VA on housing veterans. Number 4, strengthening all communities in a century of cities. HUD is looking because the Census Bureau has forecasted that by 2050, there will be an additional 80 million people here in the United States. 60 million of that number will be located in our urban city areas. So we're striving to make sure that all citizens have an inclusive way of living, working, and playing in our communities. And so number 6, we're addressing climate change and natural disasters. And when I talked about inclusiveness, that was our number 5 target with our Fair Housing Division, which is leveling the playing field for all Americans of all walks of life. In 1996, HUD had a total of 18,000 employees. Today, we are at 7,900. When I started here, I will be finishing my 14th year in December. In 2002, I had 84 employees to look at. Today, I have 39. We are a mid-sized federal agency, and the predominance of our budget is allocated to housing programs. We maintain relationships with almost 8 million residents across the country with assisted housing. HUD is presently operating on a 5-year strategic plan that runs from 2014 to 2018. One of our primary objectives outlined in detail is that our strategic plan is to use housing as a platform to stabilize households and improve health. Next slide. HUD's Office of our U.S. Department of Housing and Urban Development Office is led by the Field Policy and Management Division, which I am the Field Office Director. So we lead the design to complete our strategic goals and to meet our top targets. I work with our 5 division directors here to make that happen. We are charged with implementing those plans and objectives. My regional administrator, Antonio Riley, had a close relationship with the regional administrator for Health and Human Services, Kathleen Falk, and that is how we began to move to partner with other stakeholders to make sure that we were enhancing our objective to improve health conditions through our housing platform. Next slide, please. The U.S. Department of Housing and Urban Development here in Indiana, in our Indianapolis office, is made up of our 7 divisions. We're a full-service office with our 39 employees. We have a public housing division. We have a multifamily division, which handles our apartment side of the business. We insure apartments, and we provide apartments with subsidy for individuals who may be low to moderate income, and that rent is based on 30% of their income. We have single-family division representation. That's our FHA insurance. And as I think I've mentioned, we've insured 230,000 houses here in Indiana. We have a legal division, a labor division, and a fair housing division, which handles individuals that feel that they have been discriminated in a housing situation. Next slide. Our Indianapolis office has worked in 3 critical ways to improve the alignment of health and housing stability in order to meet and fulfill our national strategic objectives. First, our office prioritized support of health insurance enrollments through our regional administrator and through Kathleen Falk at Health and Human Services Regional Administrator for Region 5. Our support included identifying HUD-assisted multifamily developments here in Indianapolis and central Indiana that would be most receptive to an enrollment outreach. We partnered with the Marion County Health and Hospital Corporation. Eskenazi Health brought the Navigators. IU Health brought the Garden on the Go team and the Women on Wheels mobile unit. So we were able to provide incentives for residents of our multifamily housing division of coupons that allowed individuals and families to purchase healthy food, fresh food. The Garden on Go team provided cooking instructions on how to cook healthy. And the Women on Wheels moved from our apartment complexes in that area to our YMCA and Health Net that was created through a tax credit opportunity here in the city in order to attract probably our greatest number of attendees. It was a little over 240 attendees who were interviewed, and then a good portion and percentage were able to sign up for either Medicaid or the platform insurance or our state expanded Medicaid program that was approved by the Obama administration. Second, we are working to improve health outcomes through those tax credits and to create health components that are linked to our housing developments. And then third, finally, we have worked with cities around the state and our Healthy Homes division within HUD to provide lead hazard grants for 3 cities, Fort Wayne, South Bend, and Indianapolis, to address issues with children 6 and below who have been exposed to lead hazards. Next slide. HUD's Washington, D.C. headquarters office supports 3 important initiatives that you may consider mobilizing an outreach to include insurance as a component. First, HUD has issued a proposed regulation that will require public housing authorities to implement smoke-free policies. Public comment on that proposed regulation is now closed and should be made final shortly. Many of our public housing authorities will be carrying broad outreach on the new rule and how that outreach may be a good opportunity that you may find to coordinate in order to improve health insurance enrollment. Second, HUD is home to the office that concentrates on advancing the concept of healthy homes with our lead hazard control grants. Many HUD government partners uses these HUD grants to implement lead remediation programs which conduct direct outreach to families. The local office may be able to assist you with you and your local governments or nonprofits in conducting this outreach for lead-safe housing. And those agencies may be good partners in promoting insurance enrollment as part of the Healthy Home Initiative. And finally, there's an initiative that you may have heard of that began last month, and it's called Every Student, Every Day Initiative. This is a collaboration with HUD, the Department of Education, and other federal agencies that's aimed at reducing absenteeism, which can be driven in a large part by health or healthy homes issues. The rollout of this initiative in your community could be determined by the federal agencies that are near you, and it's worth you looking into that. Next slide. With our breadth of 54 offices around the country and a wide range of program areas with substantial contact to partners specifically that may be low to moderate income and those families that are made up of households, your local HUD office could be an important partner in raising health care insurance enrollment and delivering health outcomes in your community. Thank you for this opportunity to present our experience here in Indianapolis.
John, thank you so much for that information, and I think we all just agree it makes so much sense for our grade season partners to engage with HUD and with local housing efforts as we all do our outreach and enrollment activities. Next, we'll hear from Elizabeth Colvin. Elizabeth is the Director of Insure Central Texas. Thanks for joining us, Elizabeth.
Thank you. Our agency, Foundation Communities, provides a sort of non-traditional approach to getting families and individuals covered. I direct the health insurance to this program, which we call Insure Central Texas. But Foundation Communities is a much larger organization. We're a nonprofit based in Austin, Texas. We were founded in 1990 as an affordable housing organization. We own and manage nearly 3,000 apartments across 19 properties. Our agency has evolved over the years, and we now have 4 areas of focus: housing that's enriched with services, education for children and adults through our on-site learning centers, financial stability through a range of financial programs, and health initiatives, which includes helping people get coverage. Next slide. As you can see from the picture, our affordable properties don't fit the stereotype. They're beautiful places to live, and they're built with high environmental standards. Next slide. So for the past 15 years, we've offered financial programs to both the residents of our properties and to families in our community. Our largest financial program is free tax preparation, and we prepare 20,000 tax returns each year with the help of 500 IRS-certified volunteers who donate their time. We also offer money management classes, one-on-one financial coaching, and a program we call Cash for College that assists with financial aid and scholarship applications. 4 years ago, our board made a commitment to improving the health of our residents and our community, and as a result of that, we've launched several health initiatives in recent years. On our properties, we now offer health screenings, exercise classes, smoke cessation, healthy cooking classes, as well as environmental designs that promote healthy living. Our Zumba classes are actually the biggest Zumba classes in all of Austin. Our agency's focus on health is really part of a national trend. We're not unique in this because people have recognized the very strong connection between housing and health, and also income and health. So for Foundation Communities, enrolling people in health insurance is part of our healthy living initiatives, but it's also part of our work to promote financial stability. We've done one-on-one financial coaching for years, and medical debt has been one of the biggest challenges. And the reality is, it doesn't matter how much you save or how well you budget or how many money management classes you attend, a medical crisis is financially devastating if you don't have health coverage that limits your liability. Next slide. Here's our perspective on financial stability and how we see the getting families and individuals covered fits into that. So we start with tax preparation, where we're serving 20,000. That's our gateway. That's a low-touch, one-touch program, but it can serve as a gateway to these other services. Then the next step is health insurance enrollment. And, of course, During the tax preparation process, you learn whether or not someone has insurance because that's now on the tax return. So that's a great opportunity to get a referral to our health insurance team, which is actually co-located with the tax program. But enrolling in insurance is just the first step. It's not going to help your health if you never go to the doctor. So our next step is helping people navigate, use their health insurance, find a doctor, and health literacy and advocacy, really understanding their rights and how to access the services that they need. Next slide. We provide all of these financial services and health insurance enrollment in a one-stop shop that we call the Community Financial Center. And we have 2 of these locations in Austin. When the Affordable Care Act launched in 2013, we saw a need in our community to assist people with navigating that process, just like we see people needing help getting their taxes filed. What we have done is applied the model of free tax preparation model to health insurance enrollment. We rely on well-trained volunteers, and it's the volunteers that give us the capacity to serve thousands of people. We hire experienced paid staff to serve as site managers and constant support for the volunteers. And then we have carefully selected locations that have the room and capacity to serve thousands of people and are very easily accessible. Specific to health insurance, we recruit 50 to 100 volunteers and train them to be certified application counselors. We have paid site managers, and our program has also hired some paid bilingual counselors just because of the very high demand we have for Spanish speakers. Next slide. So through this model, we have been able to serve more than 16,800 individuals in health coverage in our first 3 years of operation. And it's a retail model. As you can see from the slide, we're open 7 days a week during open enrollment. We don't require appointments. You just walk in. We're co-located with numerous services. And this year we had 60 volunteer certified application counselors. Next slide. So this shows our cumulative impact since October 2013, 16,800 individuals enrolled. And for our funders, they love this next number. That's their return on investment in our program, $44 million that we have helped claim in premium tax credits, which is subsidizing the cost of insurance for low-income families and individuals in our community. Next slide. Now here are numbers for the 2016 enrollment season. As you can see, we are focused on uninsured adults and children, Spanish speakers, and other non-English speakers. 46% of the people we serve speak a language other than English. And of the people we enrolled this year in the 3rd year of enrollment, 45% of the families had 1 or more uninsured adults. And we found that when you find uninsured adults, that's a great opportunity to enroll uninsured children. Wanted to touch briefly on what I talked about, the retail model that we operate under. We're open 7 days a week, long hours, no appointments required, and that is, it's like you would want a retail store to operate. And this is how we think of it. When you want to go buy milk, you don't have to think of it. Is this the day they're open? Do I have to make an appointment? What are their hours today? You just go buy milk. And we want our services to be that easily accessible so that people can just drop in to do their taxes or get coverage. Outside of open enrollment, we operate with a more traditional basis, appointment basis with evening and weekend appointments available. We do analyze data. We're very data-driven. So we track how many people come each hour of each day, and we tweak our schedule accordingly to make the best use of our resources. So if we have very few people coming between 8 p.m. and 9 p.m. at night, we will, in the next season, decide to close at 8 p.m. just to make better use of our resources. By having only 2 locations, we consolidate our resources. So it's less staff. I need fewer printers, fewer computers, because we're only supporting 2 locations, but those 2 locations or serving thousands of people. Next slide. While we have the benefit of having our tax program right in the same room with us, that this is a partnership that can be replicated elsewhere, and it just makes sense. There are so many things that overlap between health insurance enrollment and tax preparation. You're serving the same population. We have pretty much an overlapping calendar with January and possible SEPs after January. We have similar infrastructure needs. You sort of need the same basic computer, printer, paper supplies. Since the taxes and the Affordable Care Act are so intertwined, it gives people doing enrollment access to tax expertise, and it gives tax preparers access to health insurance knowledge, which they now need in doing the tax returns. And when someone gets penalized for not having coverage, that is the perfect time to get them enrolled. And you can also do complementary outreach or do joint outreach together. Next slide. As with any program, partnerships are critical. These are some of the partners that we work with. Medical providers have been a great source of referrals when people are diagnosed and they don't have insurance. They will, their nurse navigators call us to help see if we can get insurance or coverage for those individuals. We also have a great partnership with our local FQHCs, the Federally Qualified Health Centers. We do training together. I've had my staff shadow their staff. We've had their staff come on site during enrollment season to help with specifically CHIP Medicaid enrollment if we don't have enough people doing that at the time. We also work closely with groups that serve the self-employed and what we call the gig economy, so people who don't get insurance through work. Through the Health Alliance for Austin Musicians, we helped more than 1,500 musicians and their families get healthcare coverage during open enrollment. That organization, Health Alliance for Austin Musicians, came to our financial center and operated on site for the duration of open enrollment. And it was a great partnership, and it worked really well to get those families enrolled. We've also found the community college, we actually have one right across the street from one of our financial centers and right down the street from another financial center. So that's been a great partnership. And often for students, especially students with families, the health insurance they can get through the marketplace is cheaper than the insurance offered through the community college. At least that's the case in our situation. Next slide. So here are just some resources for you. That's our organization's website, Foundation Communities, and then my program's website is insurecentraltexas.org. The next is a link to a video, and it provides a great example of the connection between housing, health coverage, and getting health care needs met. It's a story of actually one of our residents, Dalton Duffy, and it shows how really housing was the key and the first step to him addressing his health needs. If you're interested in partnering with VitaSites, that's Volunteer Income Tax Assistance, there's a link where you can find out about VitaSites in your area. Thank you.
Great. Thank you so much, Elizabeth, for that information. You guys are really doing some amazing work down in Texas. Just a quick reminder, if you do have any questions during the webinar today, please feel free to use the question box in the right side of your screen. Next, we'll hear from Bahar Passeri. She's a program assistant at the Children's Partnership. Thank you for joining us.
Thanks for having me, and I look forward to talking about how organizations can partner with businesses connect children and families to their health research. Next slide, please. So the Children's Partnership is a research, policy, and advocacy organization. We work to ensure that all children, especially those that are at risk of being left behind, have the opportunities and resources they need to grow up healthy and lead productive lives. Since 1993, we've served as a trusted resource on recognizing what is needed of children today and tomorrow. We work in California and nationally with staff in Los Angeles, Sacramento, and Washington, D.C. And more than a decade ago, the Children's Partnership teamed up with small business leaders to connect employees and their families to health coverage. So while the portion of uninsured children has reduced since that time, we do see workplaces continue to be an important place to engage families with information about how to get their children enrolled and covered. Next slide. So the challenges that we've seen are here at the Affordable Care Act has made comprehensive changes to the healthcare system and provided new opportunities for coverage to uninsured Californians and Americans across the country. In California, many of these families and their children are eligible for no or low-cost health coverage through Medi-Cal, which is California's Medicaid program, and our CHIP and eligible kids are also enrolled in Medi-Cal. Or there's financial assistance through Covered California's individual marketplace. But we do still see a good pool of children still remain uninsured. And while we recognize that every state has its own unique challenges, we're hoping that what we've done in California can be tailored in other states. Next slide. So in October of last year, President Obama signed into law H.R. 1624. This gives states the option to expand the small group marketplace to include businesses with up to 100 employees in 2016, which was earlier this year. In California, state legislation has been passed. So we define small businesses as those with up to 100 employees, and that was starting this year. And businesses with 50 or more full-time employees are required to provide health insurance to their employees under the employer mandate provision of the ACA. But small businesses, those with 49 or fewer full-time employees, are not really subject to this mandate. So we see small businesses can play a critical role in connecting these families and their children to coverage. So in order to really assess if this was an opportunity, we did some research and we found out that 1 in 3 of the remaining uninsured children in California has a parent working for a small business. While we don't know that data in other states, we do suspect that this still is an opportunity. So with more research, we've also created a briefing document, which you can find on our website. And this shows more information about how this effort is grounded in research and is really data-driven. It's a really data-driven strategy. And so overall, covering children is good for families and employers alike. Studies have shown that when children have health insurance, their parents are less stressed, they miss fewer days of work, and are more productive. Next slide. So we do see there's 2 affordable opportunities for small businesses to help connect families to coverage. And this is something that, we have researched, that we have done within our research. And one of the options is to assist these small businesses in ensuring their workforce. The Federal Small Business Health Options Program Marketplace was created to help employers with financial assistance through tax credits to help provide health coverage, as well as health insurance options. In California, we've created our own marketplace for small businesses called Covered California for Small Business. A second option is that if the employer does not provide insurance, there still is a good opportunity for them to provide information about how their employees and their families can enroll in individual insurance through Medi-Cal or Covered California. Again, it's our state's Medicaid program or the individual exchange. Now, both of these options are available year-round, so to those that are eligible. Next slide. So to talk a little bit about our strategy, our first to kind of pull this project together was our need for partnerships. And the top goal for this project, was to develop and engage with the small business organizations so we could utilize invaluable links to the small business community. It was crucial that our partners be highly credible with the small businesses, so that we are also supported by them with the inside knowledge that they have. And by enlisting the involvement of these organizations, it expanded our knowledge and reach greatly by tapping into their vast networks and providing them with our messaging with which to engage their members. So we did connect with the Small Business California, Small Business Majority, Health Law Guide for Business, the California Endowment, Covered California, and some other partners as well. And in order to kind of further our project with them, during our initial meetings with these organizations, we discussed our findings and we shared our goals with the project. So it was an opportunity to get their advice on our strategy and what type of information and assistance small businesses might be interested in to connect children to health coverage. So as the project progressed, our partners were a great resource for collaboration on the material that we created and the avenues through which they conducted their outreach. And together, we were able to create some tools and resources. We created a flyer and an envelope stuffer, and this was to equip small businesses with the tools that they would need to connect employees and their families to coverage. So our resources outline options for small businesses to benefit from these tax credits so that they can offer health coverage to employees, or to provide information to employees about health coverage options for themselves and the children through Medi-Cal or Covered California. And lastly, follow-up. We have reached out to our partners every month to try and find additional opportunities to kind of expand on this project. Next slide. And so here are our materials. On the left, you'll find our flyer, and the paycheck stuffer is on the right. They are both available in English and Spanish, and they're on our website for small businesses to print. The flyer also mentions ways employers can use the flyer and other resources listed on our website to help connect families to health coverage. And the flyer was really created with a lot of feedback from our partners. Because we are unknown in the small business community, it was important that our partners really engaged with the flyer and in the creation of it, because it would have a greater impact coming from our partners as they are a trusted resource. So we also included their logos on the flyer as well. Next slide. Some of the outreach activities we did with our partners as well. We have 2 web pages. The first one is for small businesses, employers to utilize. It contains the flyer and the stuffer as well as some other resources. And the other website is for the general public, and it outlines our strategy, our work, and also has the briefing document I was speaking about earlier. We have also created some e-blasts. We sent an e-blast to our audience, which is about 2,000 organizations. And then we've also helped our partners get the word out to their small business members by drafting an e-blast for them to share through their communication as well. And we've also shared some messaging through social media via our Facebook, Twitter, and blog posts. Next slide. Some of our lessons learned, and our first one is building on trust to the small business community. So essentially, we at CCP are building on a history. When CHIP was rolling out, we did some work with them. So it was easy to pick back up with these organizations and introduce this new project. We also have organized businesses at the state level were very excited and interested about this effort. So we received a great deal of support and enthusiasm from folks at Covered California as well. Now, a big lesson learned was that, as most of you have experienced, outreach takes relationships, which can take a long time to build, which can be difficult. So while we have interest and know that what we're doing is the right thing, the work just takes time to push through. And that follows to our next lesson with follow through. So it's hard to keep our partners engaged as they have other priorities to fight and support, such as minimum wage. So it's important to not lose that momentum and to keep the lines of communication open so so that we are engaged with our partners, so we're digging deeper as they give us a warm handoff to the partners that are on the ground as our next steps as well. We've also experienced some negative perceptions of the ACA. In California, the marketplace had some system glitches, people struggled with it. So regardless, we know that this is a strategy that takes longer to build, but has promising and viable results. And then we also see that outreach requires resources. Although we were limited on our resources and funding for this project, maybe if we had the resources, we could do more. But we made a good impact with the limited resources that we had. And another lesson learned is, while we can get numbers on how many people the messages reach, we don't have data on how many children now have health coverage as a result of this initiative. So there is this lack of a feedback loop. But this is what our next steps, what we're doing in our next steps to kind of filter through these possibilities of pushing this project forward. Next slide. So these are some of our next steps. And we've realized that with our limited partners and the need to re-strategize our effort outlets, we look at our current partners to kind of help us connect us to the smaller organizations and associations that are closer to the ground, so we can participate in a more hands-on engagement with small businesses. So we're looking to connect with smaller business organizations that are in contact with underserved communities, and also look to partner with organizations possibly in the Inland Empire and Central Valley where more Latino and undocumented kids live. We are also partnering, we also realize that the benefits that this project has, so we're striving to continue to pursue through these avenues through the small business community. So that's why we're going to be identifying additional opportunities and partners at the state level. We're going to be identifying local associations that represent business communities of color, and to identify ways to work with individual businesses to pilot. So given the important connections small businesses have to eligible families, small business employers we are working to give them these tools and resources to educate their employees about coverage options for the entire family. So mainly children, and everyone can be covered as well. Next slide. Thank you so much. And if you have any questions, feel free to reach out to us. The last website listed here has all of our information about this project that you can see links to and help link small businesses in your community. Thank you again.
Thank you so much, Bahar, for sharing that information with the group. So I know we're running a little long on time here, so I want to quickly run through some of the Connecting Kids to Coverage campaign resources we have available on our website. Next slide. You can visit our outreach library page to download tip sheets, including tips on engaging with non-traditional partners like local businesses and the state community. Next slide. While you're reviewing our outreach tool library, download some of our template materials. We have social media content and graphics you can share on your social channels, and e-newsletters that you can share with your network. You can also customize most of our materials to support your outreach efforts, and we provide materials in both English and in Spanish. The process for customizing materials takes approximately 2 weeks. All of our outreach videos and previous webinars are also available in the Outreach Tool Library on the Ensure Kids Now website. The outreach videos are short videos showcasing a variety of outreach and enrollment promising practices from groups across the country. And there are several ways you can stay up to date with the latest Medicaid and CHIP outreach strategies and stay connected to the Connecting Kids to Coverage campaign. Sign up to receive our campaign e-newsletters. They are distributed throughout the year and provide updates on campaign activities. We also want to hear from you. If you have any questions or just want to share an outreach and enrollment story, email our team at connectingkids@cms.hhs.gov. To expand your outreach, connect with the campaign on social media. Follow at IKNGov on Twitter for campaign updates and share resources across your social media channels. And don't forget to tag your posts using hashtag Enroll365, hashtag Medicaid, and hashtag CHIP. We would love to see what you are doing in your community. We have been monitoring your questions throughout the webinar and want to take the opportunity to address some of those questions. If you haven't asked your question yet, again, please type your question in the chat box now. So the first question, we'll open it up to the group. Do you have any recommendations on how to make the initial connections with non-traditional partners in your community and how to identify them? And I'll open that up to any of the speakers to jump in.
This is Melanie from Child Care Aware, and I do recommend if you're just starting out and making those connections to reach out to the Child Care Resource and Referral Agency. They'll be very informative about other folks that are working in this field. So if it's not something they're directly involved in, for example, referrals to families, they'll be able to point you to someone who is. And I think that's always a great place to start when utilizing child care as non-traditional partners.
Great, thank you, Melanie. And we'll post some additional tips in the e-newsletter. Again, if you haven't signed up for the e-newsletter, please do, and we'll share some additional outreach tips. The last two questions, we're going to put Elizabeth on the spot. We had a few clarifying questions for the information you provided. The first is the data on the 2016 enrollment slide collected to date, or is that data projected through the end of the year?
That date is actually through March 31st of this year. Yeah, that's really just, so it's from the start of enrollment season, November 1st, through March 31st.
Those are fantastic numbers. Congratulations. And then the second question for you is, you had mentioned that the calendar overlaps for outreach with tax season. And I think there was a clarification on how that overlaps because of when the end of open enrollment is, but understanding that Medicaid and CHIP enrollment goes throughout the year.
Yes. So the open enrollment season ends January 31st. Most tax preparers open in mid-January and do outreach in December, early January. So and as we know, a lot of people for open enrollment wait till the end. So we can piggyback or work together on do tax outreach and enrollment outreach in that month of January together. And then after open enrollment ends, you can still work with the tax program to promote the CHIP and Medicaid enrollment, especially for those folks who come in and their children aren't enrolled, and that's noted on the tax return.
Great. Thank you so much for clarifying those two pieces. Again, thank you everyone for joining us today, and thank you so much to our speakers for providing that excellent information. Remember, there are campaign resources available for download and to customize on the insurekidsnow.gov website. You can also access past webinars on insurekidsnow.gov, and a recording of this webinar will be available on the website in 2 weeks. And please feel free to revisit insurekidsnow.gov in the next 2 weeks to get a recording of this webinar. Thank you again, everybody, and have a great rest of your day.